everybody. Today we're going to talk about this modality, which is called diathermy. We're going to talk about the contraindications, the indications, and how to set it up for so today we're going to have a patient, and I'm going to show you guys how to set it up a diathermy and how to use it. Go ahead. Hello, how are you?
Good.
Okay, so this is our patient. We're gonna, you can go ahead and sit down. One of the most important things to use this modality is the person needs to remove everything, all the jewelry, all the cell phones, everything needs to be removed from the table. So you go ahead and take everything off, your earrings, your pins, because this is an electromodality. This, if the person will leave this on, it will produce hot spots and possible burn-ins in the skin. So now that she has removed everything, do you have any bell piercings or anything?
No.
Okay. We have to take it off the table because it can't stay on the table either. So for this treatment, we're gonna use the low back. So go ahead and lay down on your stomach and your head over here. Diathermy is not difficult to use, but the most important part is to set up correctly the patient, because the patient is going to remain in this position for the whole treatment. So to start off, we need to make the spine in a neutral position. So go ahead and lift your hips. The patient needs to be comfortable, and the patient needs to be comfortable, and the pillow needs to be placed there under the hips so the spine can be in a neutral position. Are you comfortable in that position?
Yes.
Okay. Now, the second part, when we're treating low back, is to let the area. Now we have to put a towel. This is used first to so the moist that is coming out of the skin can be kept in the area, in the towel, and also to prevent any burning. So now we're gonna set up the machine. This is the most important part. The area that is going to be treated, it's only in the drum. This that you can see here is what is going to cover the area. This is a good modality to do a deep hitting of that modality, and it's especially used in low back because it's a bigger area. You can do it with ultrasound, but it's not going to have the same effect because this is going to treat a bigger area and a deeper. So now we're gonna set it up. The drum needs to be exactly where the person is having the pain or the muscle spasm, and it has to be touching. The drum has to be touching it, because if it's not touching it, and if it's, for example, right here, the hit is going to disperse in the room and it's not going to produce the same effect. So we have to make sure that this is touching the towel and the area. Now we're just simply going to turn it on right here, and the parameters are already set up. So when you use 1 delta, you're going to use it for subacute or chronic pain. Or when you use it from 2 to 4 delta, you're going to use it to increase range of motion, to increase the blood flow, and to reduce the muscle spasm. So now that the person is already set up, we can just simply press the button and leave the patient. You can actually leave the patient, but obviously you're going to keep in touch with them to make sure that the person is fine. Contraindications for this modality is that if the person has an open wound, can do it. If a person has a pacemaker, can do it, or any metal pieces, because that's going to produce hot spots and it can burn the patient. or if the person has a rash, it will be also a contraindication. It's a very simple modality to use, and it's very good for low back pain and for deep heating of the area. So that will be it.